All right, hey ho, let's go. My name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. You've seen me do these updates now for the past few months in conjunction with the leadership of the ACOI, and I hope that these messages are helping you keep up with the latest of COVID-19. I know that many of you are in the thick of the fight, and I'd like to thank all of you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI. Moving together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing as well. All right, we have lots of really great stories today, some good news as well. So let's start talking about the virus variants. Last week, we talked about those new strains of COVID-19 that were identified around the world and very likely coming to a neighborhood near to you soon. So I wanted to follow up on that story about scientists who recently gathered virtually for a WHO, World Health Organization, collaboration on monitoring emerging variants of the SARS-CoV-2 virus. It was an epic meeting of the minds with more than 1,750 experts from 124 countries who discussed critical knowledge gaps and research priorities for emerging variants of the virus. Some important findings came out of that meeting, including the point that while it is normal for viruses to mutate, the more the SARS-CoV-2 virus spreads and transmits, obviously the more opportunities it has to change and to mutate. So what that means is that when transmission levels increase, obviously more variants will increase as well. And some of these variants that we talked about last week are now more transmissible, but fortunately not more severe. Naturally, research is continuing to see what the impact is on public health and how to respond. The WHO participants noted that genomic sequencing has been critical in identifying and responding to the new variants, and over 350,000 sequences have been publicly shared. Now, that's just from a few countries, so it is vital that more countries contribute. Increasing sequencing capacity across the world is now priority research for the WHO, and that is great news. Here in the U.S., the CDC has stated that they are also behind on these sort of sequencing and genetic surveillance for this virus. So we definitely have some catching up to do, whereas the UK has done an amazing job documenting the now dominant strain of the B117. I will have you guys also consider the South African strain that we talked about last week, and the mutation there. It's the 501V2, but the mutation that we really need to look for is the E484K mutation. And there's still a lot more to know about it, but that one may be worrisome, and I'll definitely keep you updated there. So let's talk about some vaccine updates. We have lots of great vaccine stories. So all eyes have been on Pfizer and Moderna vaccines. There's still some clinical trials, however, for the Johnson & Johnson vaccine. So it's a little disappointing for Johnson & Johnson because manufacturing delays have put them behind. In August, Johnson & Johnson signed a giant $1 billion contract with the federal government and pledged to have 12 million doses ready by the end of February and 100 million doses by the end of June. It now looks that they're 2 months behind and won't catch up until the end of April. Boo. All right. However, the huge advantage with their vaccine, as you guys know, is that it only requires one dose, so that would be great. Now, we've seen with the recent turtles paste that the vaccines are being distributed around the country. A one-dose vaccine would vastly improve the logistics of vaccine distribution. Now, the other advantage of the Johnson & Johnson vaccine is that it doesn't require those freezing temperatures that the Moderna, especially the Pfizer, minus 70 degrees Celsius, especially the Pfizer vaccine, and it can stay stable for months with refrigeration. So now Pfizer is much aware of the delays and how they can be frustrating. After all, they were supposed to have delivered those 40 million doses in 2020 and ended up falling short by about half. All in all, what we can't forget is that this has been an extraordinary effort to get to this point, and while we were all disappointed with the timetables, we can't forget how amazing the development was, as well as the high efficacy rate and lack of serious side effects for the most part. So I need to, though, mention that there was a young, I say young, I'm 52, a young physician in Florida. He was 55 years old. He was an OBGYN, and after he got the vaccine, he developed ITP, idiopathic thrombocytopenia, about 2 weeks after getting the vaccine. It isn't clear if the vaccine had anything with him developing the condition. Unfortunately, he did pass, and much love, peace, and respect to his wife and family. I think that this is a developing story, and one that I think we need to continue to monitor. With respect to anaphylaxis, there's only been 29 cases of anaphylaxis. The other side effects that you should expect, or you should talk to your patients about, is also considering the sore arms, fatigue, headaches, and fever. I know for me, I had a little bit of sore arm, but the 2 days after I had my vaccine, I was wiped out on the sofa, could not do anything, got up and did some emails, forced myself to go out for walks, but I was wiped out. But I also was, I'm lucky and very, very fortunate and very privileged that I have a job that I was able to work from home and see patients from home and do work from home. I think that we need to let folks know that these side effects are real. And for me, again, I was just completely wiped out and drained of energy. But on Saturday, I woke up and I was back to bouncing off the walls, and very grateful that I did get my vaccine. All right, so I was depressed a little bit and slightly anxious after having been so kind of wiped out, and so this is a nice segue into kind of our segment on mental health. Now, for those of us who have been fighting COVID-19 for the past year or so, we understand, and I've seen how it can damage your mental health. So many of our ACOI colleagues have suffered, and even they have contracted the virus, they had to undertake great personal sacrifice to fight it. In fact, be on the lookout for an article featuring an ACOI member in St. Louis who is an ICU intensivist and has been living in his basement to keep his immune-compromised wife and family safe. That story will be in this month's ACOI newsletter, and that's coming out at the end of the month. Anyway, my point is that many of our colleagues are suffering mental health issues. The University of Utah did a study which concluded that more than half of healthcare providers are at risk of one or more mental health issues, including depression, anxiety, acute traumatic stress, alcohol use, and insomnia. Listen, being from New Orleans, I found it fascinating that they likened the rate of risk comparable to what occurred during Hurricane Katrina and other traumatic events such as 9/11. The daily stress of working with so many unknowns is a big contributing factor. The survey included 571 healthcare workers, including 473 emergency responders, firefighters, police, EMT, and 98 hospital staff, including doctors and nurses, that occurred in about 6 weeks during the spring. Overall, 56% of the respondents screened positive for at least one mental health disorder. Alcohol abuse showed up as a major risk of concern as well. About 36% reported their behavior with alcohol was risky, which is higher than normal, which is 21 to 23% typical for physicians and emergency responders. So, what I found interesting was that they treated more cases, their anxiety level decreased. So again, as they treated more cases, their anxiety level went down. The reason researchers think that is largely due to the anticipation of the virus arrival in their own geographic area was actually higher than when they actually started treating COVID patients. And while this is not necessarily surprising, they are finding from studies that they are about to be released as well, which are larger survey samples that were conducted later in 2020. Those will give us a glimpse on how the pandemic stretching on over time affects the continued mental health status of our colleagues and others who are fighting it. Okay, so lastly, let me end with some really big, some really good news rather, that was big as well, and that would positively affect anybody's mental health, and that is winning the lottery. A nurse in North Carolina who's been working on the front lines of the pandemic won $1 million this week. And it turns out that her entry was chosen from over 513,000 entries in the final North Carolina lottery known as Supreme Riches Second Chance Drawing. And winners of this second chance drawings receive a phone call or email notifying them that they won. So naturally, when she got the call, she thought it was a scam, but it wasn't, and she's thrilled, and she hopes to use her winnings on a new home. So take solace in knowing that no matter what crazy stuff is happening in the world, it is good to know that sometimes good things happen to deserving people. So we want to give our best wishes and congratulations to Nurse Terry Watkins of Durham. So in conclusion, I just want to say thank you guys so much. Stay on the lookout for our regular updates, and to read more from the sources used in this report, you can go to the acoi.org/COVID-19. Together with the ACOI, we will help you have the latest to help you respond to your patients and stay on top of this crisis. And please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.